Welcome to Medical Specialists Associates Critical Care Medicine Educational Series. I'm Christopher Voss, MD, board-certified anesthesiologist, critical care and neurocritical care, and I am your content creator. Today we will explore the vital roles, rights, and responsibilities of members of the Hospital Ethics Committee, particularly in situations where the goals of care for critically ill patients need to be clarified. This educational video aims to provide clear guidance to help medical staff navigate these complex ethical decisions within the legal framework of California. Hospital ethics committees are multidisciplinary teams that provide support and guidance on ethical issues arising in patient care. These committees typically include healthcare providers, legal advisors, social workers, and chaplains. Their primary role is to ensure that patient care decisions are ethically sound, respect patient autonomy, and comply with legal standards. Ethics committee members have several key roles. 1. Advisory role, offering recommendations and guidance on ethical dilemmas. 2. Educational role, providing education on ethical principles and hospital policies. 3. Policy development, assisting in the creation and revision of hospital policies related to ethical issues. 4. Mediation role, facilitating communication and resolving conflicts between patients, families, and healthcare providers. As members of an ethics committee in California, understanding your legal rights and responsibilities is crucial. 1. Adherence to POLST. In California, the physician orders for life-sustaining treatment. POLST must be followed unless it is legally invalidated. POLST reflects a patient's wishes regarding life-saving measures and is legally binding. Legal protection. Ethics committee members are generally protected from liability when acting in good faith and within the scope of their role. California law provides protections for healthcare providers following advanced directives and POLST forms. 3. Documentation. Ensure that all discussions, recommendations, and decisions are thoroughly documented to maintain transparency and legal compliance. Accurate documentation is essential for legal protection and ethical accountability. When addressing ethical dilemmas, such as whether to continue life-sustaining treatment in a terminally ill patient, follow these steps. 1. Review the case. Gather all relevant medical information, including the patient's POLST and advanced directives. 2. Consultation. Engage in open discussions with the medical team, the patient, if possible, and their family to understand their perspectives and wishes. Ethical analysis. Apply ethical principles such as beneficence, non-maleficence, autonomy, and justice to analyze the situation. 4. Recommendation. Provide a well-reasoned recommendation that aligns with ethical standards and the patient's wishes. Once a recommendation is made, the following steps should be taken. 1. Communicate clearly. Ensure that the medical team and the patient's family understand the recommendation and its rationale. 2. Support the medical team. Provide guidance on how to implement the recommendation while respecting the patient's wishes and legal requirements. 3. Follow-up. Monitor the situation to ensure that the recommendation is being followed and reassess if new information arises or if the patient's condition changes. When reviewing and considering ethical principles, apply the following to ensure a comprehensive analysis. 1. Beneficence. Ensure actions are taken in the best interest of the patient to promote their well-being. Example, if a patient is terminal and continued aggressive treatment is likely causing more harm than benefit, consider transitioning to palliative care to improve the quality of the remaining life. 2. Non-maleficence. Avoid causing harm to the patient. Example, discontinue interventions that are futile and may prolong suffering without meaningful benefit. 3. Autonomy. Respect the patient's right to make informed decisions about their own care. Example, honor the patient's POLST directive, even if the medical team believes the patient is terminal, as long as it aligns with the patient's informed wishes. Or justice. Ensure fair and equitable treatment for all patients. Example, provide consistent care recommendations based on ethical standards and medical guidelines, regardless of the patient's background or socioeconomic status. Consider a case where a terminally ill patient in the ICU has a POLST indicating do all life-saving measures, but the medical staff believes continued aggressive treatment may be causing harm. The ethics committee would 1. Review the patient's medical history, policy, and current condition. 2. Discuss with the medical team and the family to understand their views. 3. Analyze the ethical implications using principles such as non-maleficence, avoiding harm, and respect for the patient's autonomy. 4. Provide a recommendation, such as adjusting the treatment plan to align with the patient's best interests and previously stated wishes. It is crucial that the Ethics Committee's recommendations are documented in the patient's medical record. This ensures that there is a clear record of the ethical considerations and the basis for the decisions made. Documentation should include 1. A summary of the ethical issues discussed. 2. The rationale for the committee's recommendation. 3. Any consultations or discussions with the patient and their family. 4. The final recommendation and any follow-up actions. In conclusion, Ethics Committee members play a crucial role in guiding patient care decisions, especially in complex and ethically challenging situations. By understanding your roles, rights, and responsibilities within the context of California law, you can help ensure that patient care is ethically sound, legally compliant, and respectful of the patient's wishes.